Hello, everyone. My name is Curtis Johnson, Vice President of Housing Strategy for Catholic Charities USA, also known as CCUSA. And I welcome you all to this CCUSA Healthy Housing Initiative podcast. The CCUSA Healthy Housing Initiative is a 5-year pilot seeking to prove this concept. The housing and social service skills of Catholic Charities, combined with the health and medical strengths of Catholic health, can effectively serve a challenging population, the chronically homeless. The Healthy Housing Initiative has 3 goals: to reduce chronic homelessness by 20%, to reduce hospital readmission rates of those served by 25%, and to connect 35% of those housed to case management, primary health care, and behavioral health services in 5 years. Today, we're going to explore an example of Catholic Charities and Catholic Health partnering to reduce chronic homelessness. To help us unpack the nuances of this undertaking by 2 mission-aligned entities is our guest, Sister Maureen McGuire, D.C., Senior Executive Advisor and Leader of Special Initiatives for Ascension, a large national Catholic healthcare ministry. Sister Maureen is a member of the Daughters of Charity of St. Vincent de Paul, a community dedicated to serve persons who live in poverty and are most vulnerable. Sister Maureen has a master's degree in social work from Temple University. She has served as director of 2 Catholic Charities agencies, and she began serving in healthcare in 1996 with mission integration leadership roles in 2 Western New York health ministries. Since 2002, she has served in senior leadership roles at Ascension. Sister Maureen shares in the collaborative leadership effort to pilot the Healthy Housing Initiative in Detroit with Catholic Charities Southeast Michigan, Catholic Charities USA, Ascension at the system level, and colleagues from Ascension, Michigan. Sister Maureen, thank you so much for being here today.
And thank you, Curtis. I'm delighted to be here today.
That's awesome. So tell us how you came to this position with Ascension.
Well, 20 years ago, my community, the Daughters of Charity, joined with several other communities to bring their health ministries together to form Ascension for the future of Catholic health ministries. Several years before that, in the social work service, I had established a residential program for women with AIDS who were homeless and had their children with them. And that was a great blessing in my life. Clearly had a healthcare component too, and shortly afterward, I began serving in Ascension in leadership of mission integration, a role that supports the organization and the individuals who serve in it, in fully living the mission and identity as a ministry. My recent transition to a new role, leading special initiatives, began when our president and CEO, Joan Pichike, responded to the invitation from Sister Donna Markham, president and CEO of Catholic Charities USA, for Ascension, Michigan's participation in this housing initiative. So that's how I got here.
That's fantastic. And we're glad that you are here with us. So tell us why the CCUSA Healthy Housing Initiative pilot in Detroit was a venture that you felt Ascension should actively support.
Well, Curtis, first of all, it certainly clearly relates to our mission. It's exactly what it is that we want to be doing. And I think the collaborative potential is wonderful. I would say, too, that our Detroit ministry has a great depth of experience in providing multiple types of services, people in leadership roles of those, collaborating with local stakeholders, relationship with the local communities, and service providers. And we can draw upon that wonderful abilities. And also because this is an opportunity for us to collaborate as ministries of the church, Catholic Charities, Ascension, expressing the life of the church together, continuing Jesus' mission, expressing God's healing love.
Mm-hmm. Well said, sister. You know, notwithstanding our mission alignment, we have to do the work. So let's talk about social determinants of health, Sister Maureen. How does Ascension address the social determinants of health?
There are a lot of examples of how we identify and respond to social determinants of health. Years. We have an organizational approach with roles and defined processes that lead to goals and measures and plans. So the local community benefit directors use a social response framework to identify the most pressing needs in their community. At this time of the COVID-19 pandemic, food insecurity was identified all Ascension areas of service. We had already engaged in this and have been operating a total of 56 food programs. We see the extent of the existing needs now beyond that and recognize the importance of having a coordinated, collaborative response for access to healthy food, which is a critical need. So that's an example of what we will be doing to take that further beyond where it has been even in an existing problem, but a much bigger problem now. Another example that we've worked on over the years to address access is called the medical mission at home. And in that, the ministries do those several times a year, go to locations where we can encounter persons who are poor and vulnerable outside of our existing facilities or clinic services, reaching out. We offer various services, sometimes making people aware of other entities in their community and linking them, making referrals for them. But we offer things like primary care physical exams, possibly dental services at times, food access.
Sure.
But it's to make connection and to give people a sense that they can have access. And one of the focal areas, the areas of attention right now, is that we have begun working on and will continue, is serving most vulnerable pregnant moms. Call it maternal health. And it's bringing the mothers in chronically missed appointments as the barriers to get there and remove the barriers to their access to care. Sometimes that even means going to their home, mobile visit, do a blood pressure screen, do whatever may be needed. Other times it's being sure they can get to what they need in terms of access. So these are a couple of examples, the assessment and the ongoing medical mission at home. We have that a little bit on hold right now because of the requirement of COVID focus, but that's a major thing that we do and that will resume.
No, but that's a clear response, and it's using examples is a really good way to help us understand Ascension's work there. Assessing your experience working with Catholic Charities USA and Catholic Charities of Southeast Michigan on this Detroit project thus far, give us an assessment of your experience thus far.
Well, I would say for sure, Curtis, that if whatever our score was, we would have the highest one, because this relationship began immediately by those representing the groups you named, with a focus on what it is we want to do together on this project.
Sure.
And there was a sense of desire for community collaboration, meaning community among ourselves, that we were going to do this together. And that's been the experience of the work through this time, was we are doing this together. We're bringing gifts and thoughts and questions. And whatever it is, it's done in a way that's highly collaborative. And I'm very grateful for the experience.
Wow. So in this collaborative, every participant in the Healthy Housing Initiative brings a set of skills or expertise or resources, et cetera. For example, speaking for CCUSA, we bring expertise and technical assistance in affordable housing and integrated health, expertise in advocacy for resources, particularly federal resources, and assistance with metrics and evaluation and those types of things. What do you anticipate that Ascension might lend to this Healthy Housing Initiative partnership in Detroit?
Well, I certainly do appreciate and recognize those gifts and skills. And I would say that we have a very extensive clinical experience in serving persons living in poverty, persons who bring complex needs. We have long experience, and it's embedded in our culture to do that well. We would look at the opportunity to develop individual care plans for the persons residing in the housing, and then to be able to assess their progress over time and adapt the plans as needed. And one of the other areas that we bring in many, many of the areas we serve is various types of behavioral health. So we can bring those in addition to the overall clinical picture. Focus on the whole person, body, mind, spirit. Holistic care is a gift we bring.
Very nice, very nice. And I can tell you from one who has been on both sides of affordable housing from a development standpoint and a property management standpoint, individual care plans are really something that perked me up, because I'm thinking of all these folks that we're trying to serve, particularly chronically homeless, are individual folks with different challenges, and you're not making one size fits all. That's going to be helpful. Thank you for sharing that. What might be an effective approach for another Catholic Charities agency seeking to partner with Ascension somewhere in your footprint?
For starters, I would say that because we're still in this design and development pilot methodology, the approach could be that someone wishing to explore this could speak with me or with another member of our team. I think that as time goes on and as it is really happening in our Detroit ministry, a Catholic Charities agency could reach out to our providers in Detroit and have conversation about, how did you get this done? How did you design this? How is it going? All of that. And they would be glad to be responsive as well and bring the experience.
Okay. So in closing, if we were to look into the future, Sister Maureen, what would you call a successful outcome for the Ascension Catholic Charities Southeast Michigan Healthy Housing Partnership, say in the year 2024?
Curtis, I would say that it is something that we could define together already, and it would be about the experience of the persons we serve. We could look at what we hope their experience would be in terms of their well-being, holistic care that they have experienced, where they are in their lives, and what it has meant to them to live in this setting. And I also think that a successful outcome would be that for us as Ascension, we would hear the desire to replicate this and spread it in the other ministry areas that we serve. And I have already begun to hear that. I have explained to some of our leaders what we're doing.
Wow.
And I didn't ask the question. They initiated the sentence, "We could do this too."
That's really gratifying, sister. Thank you for sharing that. Thank you so much for your time today, Sister Maureen. I will tell you, Catholic Charities USA looks forward to the next phase of the healthy housing journey with Ascension and Catholic Charities of Southeast Michigan and Detroit. We're so excited and glad you could spend some time with us today.
Thank you so much, Curtis, for the welcoming conversations we've had and continue to have. And I look forward to bringing this forward together. Thank you.
All right. Thank you, everyone, for joining us, and have a great day.